I'm Tim Murphy, and on behalf of the entire CapWealth team, we want to welcome you all today to our office and to our 2019 Social Security and Medicare seminar. We want to thank you for coming. If you haven't, Mike, you guys want some lunch?
Okay, thank you.
Okay. And there's drinks up here too.
Okay.
Okay, just a little fridge up here. But anyway, this has become one of our biggest hits as far as our seminars and education workshops. And so, what, 4 years ago, Frank?
Right.
We have held our first one. And so what we decided to do, because Social Security and Medicare are very complicated, as you all know. And so we recruited a couple of experts in their field, Frank Cardenas and Margaret Smith. And I'm going to tell you a little bit more about them, because they're going to be sharing information with you today. But Frank is the owner of FedLogic, and he was with the Social Security Administration for about 10 years. And his focus there was to solve the informational gap between the government and the people that they serve. And of course, since Frank left, as we all know, it's gone really downhill. But anyway, Frank started his own company, FedLogic, and he works with individuals and families to help them and to help inform them, help them strategize, and then to help them plan for what's best for them. Margaret Smith is the president of Medical Accounts Management, and Margaret's an independent insurance consultant in Green Hills. She has a passion for helping people, individuals navigate the confusing territory of health insurance, and so she also created her own health care benefits management and consulting company. She's a regular speaker around Nashville, sharing insights about various parts of Medicare, and just helping people again to navigate through the difficulties and the complexities of Medicare. So without any further ado, I'm going to turn it over to Frank. I think you're going to go first, right?
Yes, I think so.
And you guys enjoy. Restrooms, for those of you that don't know, go back out the front door and left down the hall. And there's drinks up here. Surrender, there's lunch over there and drinks up here. So if anybody needs anything, just grab Carrie or throw your hand up or something and she'll get taken care of. Okay? Thanks again for coming.
Sure.
All right. Thank you so much for that. And yes, this is my fourth year doing this for CapWealth. So I really appreciate you guys having me out. And I'm going to throw a lot of information at you today. We're trying to keep it really simple. But one of the best things about FedLogic, myself working with Carrie and everybody at CapWealth is that not only do you get information and some education about Social Security today, but you guys also have access to FedLogic through the CapWealth client. So if you want to just touch base here, then if you have a very specific question, we're going to be there to help you as well. Okay, so it's a good thing. So today we're going to kind of take a 10,000-foot view of Social Security and how it works and the inner workings of when to draw benefits. But if there's something specific, then we can cover that during our question and answer that we're going to leave time for. Okay. Really quick, my background. Like Tim said, I spent almost a decade working for Social Security and with Medicare. But it's also been kind of my calling, a passion of mine. I was born in rural West Tennessee in Brownsville, if anyone knows where that is in Tennessee, right outside Memphis. Population 12,000 people back when I was growing up. But what's important about my personal background and my story is that my parents were immigrants to this country. My dad had a job transfer. He immigrated back in the 60s, but he job transferred from Los Angeles to Brownsville, Tennessee back in 1982. So back in 1982, there weren't many Hispanics this side of the Mississippi yet. So it was a big of a culture shock for them. And then unbeknownst to them, they were also bringing my one and only sibling, Alex, with them. She was born in Los Angeles. They brought her over, and they didn't know this until she was almost approaching 2 years of age, because they had me shortly thereafter, and they started to realize that this baby, me, was kind of surpassing everything that Alex was doing. Alex was still not talking or walking or doing anything yet, and she was approaching 2, so they went to their doctor's office and they asked the doctor, if Alex was what they would call back then, quote unquote, normal. And that's when they realized that, no, Alex was born with a severe mental disability. She may have not looked, that something was wrong, but she did have some cognitive issues, and come to find out she was severely mentally disabled. The reason that's important is because my entire life has been to help Alex through IEP programs, navigating disability, state benefits, helping my parents with the language barrier, helping other families in the same situation, and then call it divine or what you will, but I graduated from high school from Brownsville, went to school at Memphis, came to Nashville for law school, and all I wanted to do was public service. So in my mind, I said, well, I'm in law school, I think I should work for the federal government. And this first administration that called me up was the Social Security Administration. And I spent almost a decade working with them. I went from being an adjudicator, I adjudicated individuals' retirement, their widow benefits, spousal, disability, Medicare, things like that. And then I became an analyst for the state. I would take national policy, interpret it, send it all to all the field offices in Tennessee. And then I became a congressional liaison. And in that role, I became Mr. Fix-It. So when Senator Alexander or Congressman Cooper had a constituent that was upset enough at the federal agency, their congressional liaison would call me, and I would sit down and figure out who dropped the ball. Was it the agent? Was it the family didn't have right information? What went wrong? And I would sit everyone together, and I would just fix it. And that's where I realized that, this is complex. You have to be trained for at least 2 years to become proficient in the Social Security law, Medicare, needs-based Social Security law, and people are at a disadvantage. On top of that, federal agents cannot advise your family on your benefits. They're there to answer the question that you pose to them, and that's it. So if you don't know what question to ask, you don't know what your benefits are. You also don't know how to maximize them. And you sure probably don't know how to actually go get those benefits squared away and apply for them. So when I got into management and then upper management, I realized that 10% of my week was dealing with families who were upset at my employees. And it's because even though the employees are great people, they took an oath of public service to help, but because of the complexities of the laws, the way the federal government is structured, the inability to advise a family, it really puts the American public at a disadvantage. So I give credits to, Margaret knows this, FedLogic was not my idea, it was my wife's idea. She said, well, if you're that frustrated, how would you do this better, working within the federal government? And I said, I don't think I can, because I can only train these employees enough, but not be able to go over the threshold of being able to tell families. Plus, we don't have the time or the resources. She said, well, how would you do it? I said, well, I would sit with every single family and navigate the entire thing for them. Not tell them what to do, not advise them, but paint the picture so clearly that you knew exactly what benefits you can get, because every case is a case-by-case basis, and then I would give you the practical help. And she said, why don't we do that? And we did that 5 years ago. It was just me and her at the time. But here we are 5 years later, we have 5 experts working from home, and we have over 280 companies that are signed onto our service. And 100,000 households, including yours, have access to our experts so we can help navigate you through this whole thing. Okay? So that's our story. So it's very mission-driven. We're just here to help. We're not here to tell you what to do, just merely just educate you. So today, what I'm going to do is kind of cover some information regarding Social Security, some of the things that you hear in the news about it, some simple things. Everyone's going to be affected by Social Security. From the time that we're born, we're issued a Social Security number, we start working into our own Social Security trust fund. Okay? Now, Social Security is typically, people start thinking that it's just for those who are 60 or older, Medicare age, retirement age. But I want you guys to remember today that Social Security is there as a safety net feature. Yes, it's there for your retirement, but it's also there in case that, someone passes away. Okay? You get disabled. Okay? And of course, Margaret's going to be covering the Medicare program. But there's also other programs like SSI. SSI is a needs-based program. So case in point, my sister Alex, who will never be able to work or work enough to become insured for her own retirement or disability, there's programs for her under the needs-based programs through Social Security, SSI. Okay? Now, the reason I tell you guys, even though most of you guys are working individuals, is because we all know a family that may have a disabled child. And when that disabled child turns age 18, they're considered an adult in the federal government's eyes, and they can access programs like this. Okay? We all work and pay into this tax right here, so it's there to help those individuals. Okay? Now, the standard of proof for disability is very high with the federal government. There is no 75% or 25% disability. It's either yes or no. So whether you're looking at disability or SSI, these programs are due to those individuals because they are indeed disabled. We'll cover IRMA. Margaret may also cover that. This is just an income-related Medicare adjustment amount. For those individuals who are higher income earners, you are also not just paying the $135 for your Medicare, you may be paying more, okay? So you need to know how that works, but also know that you can actually get this reduced, okay? If you have a life-changing event, like retirement, you can actually request your Medicare premiums to be reduced, get your IRMA reduced. And of course, cost of living increases. Once you activate any benefit with Social Security, you're locked in. Your rate is locked in. But it can change with any cost of living increase passed by our boys and girls in Congress. Okay? Let's kind of go into, now this is a question we always get. Is Social Security running out? Okay? We hear about it all the time, the news, the candidates say that we're depleting the system, Social Security will not be here for our next generation. Okay? Let me give you the truth. The truth is that yes, by the last trustee's report, by 2034, they're only able to pay 79 cents on the dollar, okay? It's 21% hit. So that is scary, I get that, okay? Now, the reason that happened is that if you see the big blue over here, that's your retirees, okay? These are our baby boomers, okay? Now, this is not to place blame on baby boomers because you guys worked hard and paid into this system and you're getting out what you paid in, okay? The baby boomers are coming in and retiring at a rate of 10,000 people per day in the U.S. So between retirees and their dependents, that's where the blue comes from. Okay? We just got out of a recession. Okay? So if you imagine this entire room has been the Social Security Trust Fund, okay? When you have a recession and not a lot of people are working, okay, and you have retirees coming for their benefits, you have more money leaving the room than you have coming in. And then you magically get this number of 2034. Meaning that between now and 2034, they can pay 100 cents on the dollar, and come then, if nothing changes, you can only get 79 cents on the dollar. Okay? Now, I'm here to give you peace of mind, to tell you the why it happened, and what's going to happen between now and then. Okay? Also, during the recession, what do a lot of people do if they're not able to find work? They file for disability. Okay? So you also heard a lot in the news about 5 years ago that people were stealing from the trust fund, that they were taking from the retirees and putting it somewhere else. It was just an accounting measure. No money left the Social Security Trust Fund. It's just money that was dumped into the room was pushed over to disability because more people were filing over here. Okay? All in all, between now and 2034, there is going to be some kind of change in order to keep the trust fund solvent beyond 2034. Why? 85% of the people who received these funds rely on this money. Okay? And if you hit them with a 21% cut, it will really just be crucial for a family. So between now and then, more than likely what they'll do is, as of right now, they only charge up to $127,000 in work earnings into the trust fund. They'll probably push that up. Okay? For our future generation, they may actually raise the retirement age. Okay? As of right now, anyone born between 1954 or earlier, your full retirement age is 66. If you're born after 54, it could be up to age 67. For the future generations, my kids who are not able to walk, talk, or vote, might be push it back up. Okay? Those are things that may happen. Okay? But probably the thing that will happen the quickest is that they'll raise the rate from 127 to maybe 150 or 175 in order to push more money into the system. Okay? But that's what's going on. So, sigh of relief, it's not going anywhere, and it more likely will be 100% solid between now and 2034. Okay? Alright, so what do you need to retire? All you need, anyone in the United States, is you need 40 credits to retire. You get 4 per year. So anyone who's worked 10 years can receive some kind of Social Security retirement. Okay? We'll talk about the age to retire and how do they compute your benefit amount. They take the highest 35 years of earnings. Not your last 35, your highest 35. So if you draw your benefits and 2020's earnings are more than 1977, they'll use 2020's earnings. Okay? But it's a big misconception. They take the highest 35. Well, the question I get was, what if I only work 20 years? Okay? They will take the average of your 20 years to compute your benefit amount. Okay, when to draw benefits. Before we go into the factors, let me kind of tell you guys, let me show you guys this real quick. I'm going to use my body as you on the timeline, okay? Now these numbers and these ages hold true for anyone born before 1954. If you're born after 1954, say 1955, it's 66 and 2 months, okay? Just add 2 months for every year beyond 54, okay? If you get to 66, 67, then that's your top out, okay? I like to set these up. My wife made these for me so that way it's easy to kind of comprehend. Retirement starts as early as age 62. As you can see, you can draw your benefits, but you're only going to get 75% of them. Okay? If your benefit is $1,000 here it's going to be $750. Perfect. Okay. Now, this Social Security benefit amount will go up every month that you wait, and there's going to be a 25% increase between early retirement up through here. Okay? Now, it's really important to understand. If you are drawing benefits anywhere this way, okay, anywhere before your full retirement age, two things are happening. One, you're going to lock in your rate. Okay, say if you're 63, you're going to lock in 81%. Okay, that is locked in for life. The other thing that happens is that if you draw your benefits prior to 66, you're also subject to something called the annual earnings test. If you're working, you can only make a mere $17,000. Okay? So for everyone in this room, if you're working and you're making over $17,000 in work earnings, we're talking about 1099s and W-2s, then you're not drawing your benefits until one of two things happen. You retire or you get to here. When you get to your full retirement age, you get 100% of your benefit at least, and it no longer matters to Uncle Sam how much you're working or how much you're making. Okay? So this is a very key piece, this whole thing. Okay? They've talked about in the past years about changing that rule, but for everyone in this room, if you're able to vote, more likely that will never change, just because that would be kind of a big disadvantage for us, okay? So remember, if you get to here, 100% of your benefit, and it no longer matters how much you're making. There's also an incentive. Uncle Sam says, what if you don't take it here, and you go this way with it? For every year that you wait, you get 8% increases. And then you top out at age 70 at 132%. Okay? No one should ever wait to draw their Social Security retirement beyond age 70. Uncle Sam gives you no extra benefits beyond this point. Okay? If you find yourself here, you lock in your rate as well. You also have the ability to, say if I'm 69, I'm at 124%, I can lock in my benefit at 124%. Or I can also ask Uncle Sam to do something called retroactivity, meaning I can look backwards 6 months. I would draw my benefit here, okay? Uncle Sam would give me 6 months worth of checks, but my benefit wouldn't be 124%. It'd be 6 months less, which is 4%. It'd be 120%. The reason that's important is because what if you were waiting to draw these extra percentage points, because it is, pretty big, but then something happened to you health-wise, okay? You may not live long enough that way to recoup, but at least you can look backward 6 months. Does that make sense? That 6 month look back only happens here. Okay? We're going to talk about spousal benefit and widow benefits, but this is your timeline that you're looking for your own Social Security retirement. Okay? Now remember, I'm not your financial advisor. That's what CapWealth does. Okay? What I'm going to talk about is the actuary math that comes to your Social Security, okay? So we work with actuaries and Social Security, and this is the math that we kind of developed so that you guys know. You're looking at 3 factors. The most important is need, okay? Do we need the money? If you need the money to pay for your mortgage or pay down credit debt or whatever, then that's where you stop. Let's assume the answer is no. You're over here, 67 years old, you don't need the money. You gotta look at health. Why is that important? Because remember, let's put this one back up real quick. If my benefit, if I'm a top out individual, and my benefit here is $2,600, okay? If I don't draw the benefit because I want to get 108, 116, 124, 132, what I'm doing is I'm sacrificing $2,600 a month, right? How long this way do I need to live to recoup that before I start making money on the decision of waiting for the extra percentage? And that's where the health comes into play. To keep it simple, whenever you draw your benefits, you gotta live 12 years beyond that date. Okay? It's a good rule of thumb, and we'll go through the math about it. Okay? But health, you look at your family history of life expectancy, you look at your current health. Okay? If you were working with me, I would say, what do you feel about this? Okay? What does your family history show you? What does your current health show you? And then the last one is strategy. There are a lot of different leveraging techniques to Social Security retirement benefits, mostly coming through the spouse. Okay? But we'll cover those are 3 factors that you look at about when to trigger your benefits. Now, after you get educated through today or with us, then you make sure that you run that before, by CapWealth before you do anything. And then we'll help you on the practical side, get it filed for you. Here's how your break-even works. You guys remember this statement here? It used to go out to every single person who worked even one day in the United States. Now the statement is all online, or if you're over 65 and still working, you still get this. But that is where you get your full retirement age. In this case, it's 66 and 4 months, and there's their benefit amount of $2,400. Okay? If you haven't already, you go to this website, ssa.gov, and you sign up for my Social Security online account. And it's really important that you do that. Everyone in this room, whether you're 60 or you're 20 years old, go to ssa.gov and sign up for your My Social Security online account. They're going to ask you 4 credit questions. They're going to be very hard. They want to prove your identity online, which that threshold is really high. Once you answer those 4 credit questions, you'll make your username and password. You have access to your retirement benefit now, at 66, or later. You'll see how much your family would get in a survivor benefit situation. You'll see how much you get in disability. The reason it's important is that you have access to that data, but in addition to that, you also, if you ever need to draw your benefits in the future, they're going to require you to do this anyway. And beyond that, once you start drawing your benefits, if you ever need to change your address, ask for a new Social Security card, change your bank information, you can do it online. Okay? SSA.gov, my Social Security online account. Okay? Here's the break even. Here's how it works. All right, so let's go through it real quick. My benefit today, I'm 66. At 100%, I'm $2,600. Okay? Let's keep it simple. 48 months between now and then. Okay? It's a total of $125,000. So while I'm working and I don't need the money, it's just going to get bigger and bigger and bigger. But between those 4-year span, those 48 months, I've sacrificed $125,000 that I could be receiving from my Social Security. Okay? You look at what your benefit would be increased by that 32%. Okay? If your benefit was $2,600, you add 32% to it, your benefit here would be $3,500. It's a big jump, right? So what you do is you take what you've sacrificed, the money you sacrificed, and the increased amount, and we're going to get this big number here, 138. That's how many months it takes to break even. And roughly it's going to be 12 years. I just wanted to show you the math, but from the point that you start your benefits, just remember 12 years. I've got to go to 12 years. If I don't feel comfortable with 12 years, then you may want to activate them earlier. And just keeping in mind that if you're younger than 66, if you're working, you're not drawing the benefit, right? Does that make sense, everybody? Okay. But it's roughly 12 years. Okay, who else can receive benefits off your record? Children. If you have any children under the age of 18, 19 if they're still in high school. Okay? This happens a lot. 2nd, 3rd, 4th, 5th marriages. The individual starts to draw his retirement benefits or her retirement benefits, and they have children later in life. Children under the age of 18 can receive 50% of this number here. Okay? So that's important because if someone is 66 years old and they don't need the money, but they want to wait till later, but they have 3 children all under the age of 18, well, they're going to get their 100%, but each child will also get 50%, each one of them. So, disabled adult children. Let's do my example, Alex, my sister. When my parents file for their retirement next year, and he draws his benefit, he's going to be 64, then she will draw, because she's a disabled adult child, she'll draw 50% of whatever his full retirement amount is. Okay? The criteria there is that child has never been married, they became disabled before 22, and they haven't worked and paid into their own Social Security trust fund. Okay? Spouses, okay? Generally speaking, spouses get 50% of this rate here. Okay? When you're looking at spousal benefit, take 50% of your spouse's benefit here, and then look at where you are on the timeline. If you're 62, then you're only getting 75% of that spousal benefit. Okay? Does that make sense? 50% of the full rate, and then wherever you are on the timeline. If you are getting a spousal benefit and you're age 66, then you're getting exactly 50%. Okay? You don't get both as a spouse, you get the higher of the two. Okay? If a spouse is getting $1,500, and then she's also eligible to get $1,300 off of my record, 50%, she's not going to draw her spousal benefit, she'll draw her own. She won't have the ability to draw on the spouse. Ex-spouses, those are really important. Anyone who's been married for 10 years or more, same rules apply. Okay? As long as they did not remarry, ex-spouses have the same rules. So remember my example, I had 3 ex-spouses. If none of them remarried, same rules apply to them. 50% of this, and then wherever they are on the timeline as far as the rate goes. Okay? All you need there is marriage certificate and divorce decree to prove 10 years worth of marriage. That does not affect my own benefits, does not affect my current spouse's benefits, it doesn't affect anyone else's benefits. These are just benefits that are due to ex-spouses. Okay? Now, a question I always get is, what if you have your own benefit going, your current spouse is receiving 50%, and you have 3 ex-spouses all receiving 50%? How does that math work with Social Security? It doesn't. Okay? You're going to actually get more off the table than you put on the table. But those are just the rules because they also put in their time and they're due the same benefit. Okay? All right, we've already gone through this, but just so you see it, 50% of your spouse or ex-spouse's full retirement amount. You can get spouse or ex-spouse's benefit if it's greater than your own. Okay? Or it's combined. Okay? Let's go back to my example. If my full retirement benefit is $2,600, my wife is entitled to $500 on her own record. Half of $2,600 is $1,300. She would get the first $500 from her record, up to the $1,300 would be coming from my record. It's combined. Okay? But the total amount would be 50% of mine. Required documentation is just a marriage certificate and a valid driver's license. That's it. And if it's ex-spouse, marriage certificate and divorce decree. Okay? And no remarriages. Survivor benefits. These are really important as well. Okay? Anyone passes away, their surviving spouse or surviving minor children will get a lump sum death payment. Okay? Just a one-time payment of a whopping $255. Okay? It used to be called a burial fund. Now it's not called that because it doesn't pay for anything pretty much for $255. But it's harder to take it out of the law than to keep it in there. Okay? So when you go to file for your widow benefit, they will do that if it's within the 2 years of the passing. They will give you $255 into your bank account. Okay? Who can receive survivor benefits? Surviving spouses, surviving children under the age of 18, or surviving disabled adult children. Okay? So something happens to my mom or dad, Alex will be able to receive survivor benefits. Survivor benefits for children are paid at 75% of this number here. Okay? For widows, it's a little bit different. We'll get to that, okay? The proofs, nowadays, most of all funeral homes send in the death certificate, so Social Security has it. You know, just give them 2-3 weeks and they'll have it already. How it's paid, surviving children get 75% of this record. Surviving widows, spouses, will receive, I'm about to go through that real quick. Okay? Remarriage, okay? If I pass away, my wife can get widow benefits. But if she remarries, she cannot get widow benefits. Okay? With the exception of if she remarries after age 60. Okay? If a widow remarries after age 60, they have the option to draw off of their current spouse or their widow benefit. Now let's talk about the timeline on widow benefits. Remember, the blue is your own retirement. Widow benefits start as early as age, over here where Margaret is, age 60. Okay? They start earlier. Okay? Over here, even though these percentages are your own retirement, a widow gets about 82% starting at age 60. Okay? And then it goes up and up and up and up to 100% if they're full retirement age. Okay? The percentage is higher for a widow because they're going through a tough time. They're a survivor. So 82% up through 100%. There is no additional benefits to a widow beyond age 66 on their widow benefit. Okay? One other thing. Widow benefits are as early as age 60, over here where Margaret is. But then over here where Carrie is, if you're a disabled widow, start as early as age 50. So if you become disabled and you're a widow, you can get your widow benefits earlier at age 50. If you're disabled, you'll get paid your full widow benefit. Okay? I know, it's a lot. Okay, there's some additional factors that I just kind of touch on, so that way you can call us if this is you. Okay? But for the most part, it won't affect anyone in this room. Okay? If you've ever worked as a teacher and you paid into your own retirement system outside of Social Security, you can be subject to GPO or WEP. Okay? Those are our military individuals or people who work into Social Security or their own retirement systems outside of Social Security. Okay? That happens a lot in Tennessee. If you were working as a teacher back in the 70s or 80s, you had the option. Do you want to pay taxes over here in Medicare and over here? Or do you not want to do Social Security taxes and get your own pension through the teacher's pension union type thing? Okay? Just keep that in mind in case that's you. Okay? If you ever worked abroad, okay, remember it takes 10 years to become insured for your own retirement, but you worked 5 years in the US and 10 years in Canada or in the UK, you can combine your work earnings from both countries. Okay? And it's not usual, but it's out there. Okay, disability. Really quickly. We've all worked and paid into the system. Okay? The way the disability works, to keep it simple, everything I worked and paid into retirement is there when I turn 62 at this rate, 66 at that rate, or if I want to leverage it out. But what happens if I'm 38 years old and something happens to me, I'm no longer able to work? Okay? I can file for disability. Okay? Now, it's either 0 or 100% disabled, so the threshold is really high. But the equivalent of what I'm going to get paid is what I would have gotten at my full retirement age anyway. Okay? So they kind of make it where, look, it's not your fault that you became disabled. If we can prove that you are disabled, you'll get your benefit, whatever it was, at 66, even though you may be only 40 years old. Okay? But the standard of proof is really high. You have to prove that you're 100% disabled and no longer able to work. Children with disability, okay? If I have a child that was born with cerebral palsy, okay? Up through age 18, they'll be looking at my resources. But when that child turns age 18, like I said earlier, they can receive benefits off of the Social Security SSI program. Okay? And of course, spousal benefits, also same thing under disability. Okay? Okay, we're going to kind of go over Medicare just really quickly because we're going to get more into detail with Margaret. One thing that I want everyone to write down in case this affects you or anyone else out there, okay? There's something called restricted spousal application, okay? Restricted spousal application, RSA, okay? They took a lot of laws out that allowed us to leverage spousal benefits along with your own. But what they did leave in there is restricted spousal application. And the way that works is that if one spouse is drawing their benefit and the other spouse has reached age 66 and they were born before 1954, January 1st, 1954, then that spouse can draw 50% of their spousal benefit and let theirs grow. Let's walk through that. I'm 66, I started drawing my benefit, okay, $2,600, okay? My spouse, who's also age 66, and she was born before 1954, then what she can do, because I started my benefit, she can draw 50% off of my record, $1,300, but let her own benefit continue up and tick up to whenever she wants to switch over. Okay? That's called restricted spousal application. Remember, one spouse has to be drawing, the other spouse has to be 66, and born before January 1, 1954. And if you think about it, if I can get $1,300 for 48 months and then switch over to my own record, that's a lot of change. Okay. So that's the last law that we have that's still in the books that could, really leverage out your Social Security. But again, one more time, you got to be 66, you got to be born before January 1st, 1954, and your spouse has to be drawing benefits already. Okay. Now, a couple things I want you guys to learn today too. You have access to FedLogic. Okay. The other thing is, don't ever, ever, ever call the 1-800 number for Social Security. Okay? There's no point to it. Okay? There's absolutely no point to it. You're going to get frustrated, you're going to get upset, and then you're going to get upset at me that you did call. I'm going to remind you that I told you not to call. Okay? The reason that that it's so frustrating is because the individuals who are answering the phones, they're not adjudicators. Okay? They're teleservice representatives. They're there to guide you to the person that can answer your question. But these individuals took an oath of public service and they want to help you. So they'll try and feed you a little bit about what you want to hear. But then when you call in and you get someone else, they'll tell you, no, you can't do that at all. And then you get frustrated. Okay? If you ever need help with Social Security, this stuff, filing for benefits, if you don't go through FedLogic, then what you can do is make an appointment with Social Security. Okay? That you should do. Okay? If you ever need to go in there, Margaret and I were talking earlier, if you need to go in there and you don't have an appointment, then be there at 8:30 because they open at 9. Okay? That way you get the first person in and out. Okay? Does that make sense? Okay. I'm only telling you that because I work there. Okay. All right, Medicare. Margaret's going to go into this, but obviously Medicare 65 or older. My wife conveniently put this under a different color because she wants you to remember that your Medicare has nothing to do with your retirement. Okay? Completely different color because when you get 65, it doesn't necessarily matter about your Social Security. Okay? Medicare can be independent of that. Okay? You can get Medicare at 65 juncture or older, 24 months after receiving Social Security disability, or if you have ALS or dialysis. That's a big misconception. If you are on self-administered or you're going to a dialysis clinic, you can jump on Medicare within 4 months as your primary. Okay? For a lot of families, that's going to be a good thing. Yeah. Now, if you ever file for Social Security benefits, okay, when you get to 65, even though you may not want Medicare to be your health insurance because maybe you're covered under your employer, you will automatically get Medicare A. Okay? Margaret will go into detail about the different parts of Medicare, but you will get Medicare Part A. Part A is free and only covers hospital, ER, and hospice, but the reason that Margaret and I work together on so many cases is because we have to explain to families that because you drew benefits, you have Medicare Part A. Yes, it's free. Yes, you're not using it, but you are prohibited from doing an HSA. Okay? So if you love your HSA, and you're getting to 65, then you don't need to file for anything with Medicare. Okay? Now, media will tell you if you don't jump at 65, you're going to get penalties and all that. Okay? What you need to know is that if you are covered under a group health plan through your employer or your spouse's employer, then you're okay bypassing Medicare. Okay? You can do that. There is no penalties. But if I'm 67 and now I'm talking to Margaret about getting on Medicare, there's going to be 2 forms that you need to fill out for Medicare to prove to them that you were covered under a group health plan back over here when you were 65. Okay? So just key things there. All right. Let's see. I'll let Margaret cover the parts of Medicare. All right. IRMA. Now, Medicare costs $135, okay, for the Part B. It's covering 80% of your healthcare needs. Okay, Margaret will get into detail about this. But if you're a higher income, say if you file your taxes married filing jointly, and your AGI is over $172,000, then you will pay more than the $135. You'll pay the $135, and then it's scaled. There's 5 thresholds to IRMA. Okay, the more you make, the higher you are going to pay. Up to $600 total cost. Okay, so keep that in the back of your mind while you're making that decision. Okay. Lastly, anything you do with Social Security can be appealed. It's just a matter if you want to take on the headache and if it's worth it. Okay? What I'm telling you today is that whenever you do draw any kind of benefits, make sure that you are triggering when you absolutely are 100% sure that you want to, okay? Because it's hard to take it back, okay? That's the other thing. If you start drawing any Social Security benefits, if you've already been drawing them for 100%, no, you've been drawing them for 1 year, there's no going back, okay? You started your benefits and you got to keep going, okay? But you can appeal anything. The last thing about the appeal process, whether you use us or not, one thing that you should know is just what I did when I was working with the federal government. Don't be scared to call up your congressman or your senator and say, I need help. And then a congressional liaison is done, and then they go on your behalf and they talk to someone who knows what they're talking about with Social Security. Okay? So don't use that, for anything, but if you get really in a pickle, then you have that as a congressional, it's called a congressional liaison. Congressional inquiry, sorry. All right. Any questions for me on Social Security retirement benefits, widows benefits, spousal, before Margaret gets started?
Back in the back.
Please,
Yes.
just back on the spousal benefit for a second. We're really only talking there if the spouse doesn't qualify for Social Security, that she would be able to claim 50% amount.
That's right. Or if the spouse's benefit, maybe they only work, 10 years or 12 years, and their benefit's like $700.
Okay.
Then, yeah, you would want to look at 50% of yours, because 50% of yours may be $1,300.
So, if she qualifies, hers is 2,000, mine's 2,600, we're better off to just.
Draw on your own, right. She would not want to draw her spousal benefit because it's going to be less than her own benefit, correct.
And I thought I had read somewhere that there was some changes that went into effect July 1st of 2019.
On the spousal benefit, no.
Yeah.
Yeah. No, the only thing that's now being phased out as of this year are those 1954 or later. Because
Right.
if you're born in 1954, how old are you this year? 66 now? Okay.
65.
65. So we only have this year and next year that restricted spousal applications can be done. So those are the ones that we're looking at to tell everyone, hey, if this is you, you may want to look at that and get those extra spousal benefits. Good question. Any other questions before I hand it over? Thank you guys so much. Obviously I'm here, so if y'all need me for anything, let me know.
Thank you. Oh, thank you. So I'm just going to piggyback real quick before I segue into my part about that congressional liaison, because I have had to use that sometimes with my clients, and before I even really knew that that was even an option, and I asked Frank about that. So if you've exhausted every avenue trying to get somewhere and you just feel like, I know I'm in the right and I'm up against a brick wall, it truly works. I mean, you have to give them time to work on your behalf, but it is a wonderful situation. Okay, so I'm going to try to blitz through Medicare in about 30 minutes or less. So there's a lot of information in here, but you can ask as many questions as you need to, and my contact information is at the end, and you can always call me or email me. But here we go, Medicare 101. Ooh, wrong way. Frank has this one.
The right one.
Oh. All right.
There it is.
There we go. All right, so here's the 4 parts of Medicare. There are 4 parts. If you have an original Medicare card, then you're going to see that it says Part A and Part B. And for all intents and purposes, Part A is what covers the hospital claims. B pays your physicians. C is another name for Medicare Advantage. If any of you all have Cigna HealthSpring or have a family member who has Cigna HealthSpring or Blue Cross Blue Shield Blue Advantage, those are examples of Medicare Advantage plans. And I'm going to get into the differences about original Medicare versus Medicare Advantage a little bit later on. But they're completely different delivery mechanisms of your Medicare benefits, completely different. So it's very important to know what those are so you can make the best decision for you. Oops, wait a minute. Part D at least makes sense. That's the drug plan. Alrighty, so I'm going to talk a little bit about when can you sign up for Medicare. Frank already alluded to it. It officially starts at age 65 unless you're disabled and you can get into Medicare earlier. But the first enrollment period for everybody is the 7-month window surrounding your 65th birthday. So it's the 3 months before you turn 65, the month you turn 65, or the 3 months after. But depending on which one of those months you enroll into your benefits, that determines your effective date. Medicare is always, always, always effective the first of a month. People are like, but my health insurance, I mean, I really only need it in the beginning. I'm like, no, it's always the first of a month. So, but depending on when you sign up in that 7-month window, that will determine your effective date. If, as Frank already mentioned, you are actively working or the dependent of someone who is actively working and covered under an employer or a union plan, you can defer coming into Medicare at age 65 without having to worry about the late enrollment penalty. So there is so much misinformation about that. Even if you look it up on Medicare.gov, which is an amazing website that I probably go to at least once a day, it is very ambiguous about that post 65. If you're working, can I not enroll and avoid the late enrollment penalty? I'm here to tell you, as is Frank, you can. But the special enrollment period, you get to decide when you want your Medicare to start. So let's say you're 67 and you're like, well, I think I want to retire as of March 15th. Well, then we would work it out in the timeline, but your benefits would not start until either April 1st or whenever you decided to tell Medicare you want it to come in. Remember, it has to start the first of a month. The reason why I say beware of COBRA is because most of us here know that you can have COBRA for up to 18 months. Sometimes it's 36 months in special situations. But if you are Medicare eligible, 65 or older, and you stay on your COBRA for longer than 8 months, you will get the late enrollment penalty. And that is something that I see happen all the time. People will call me and say, well, I was Medicare eligible, but my spouse wasn't until recently. And I'm like, but are you still actively working and covered under your employer plan? Like, no, we took COBRA about 10 months ago. I'm like, oh no. Government doesn't recognize that. If you are Medicare eligible, I'm going to say this again, and you stay on COBRA for longer than 8 months, you will have the late enrollment penalty. And when that happens, you have to wait until the general enrollment period. So the general enrollment period is the one that I don't want anyone in this room to ever have to go through, because that means you missed your applicable enrollment period. And so when that happens, you have to wait between January 1st and March 31st of every year to come into the general enrollment period, and your Medicare benefits will not start until July the 1st of that year. So a lot of times people's COBRA runs out before that July 1st start date, and then we're in a pickle. So remember your enrollment periods, it's very important. So why would you ever want to delay Medicare? We mentioned earlier, Frank did about HSAs. So also because of the IRMA. So the Part B premium is what you have to pay for. Everyone who's worked into the system long enough gets Part A for free. But as Frank said, if you enroll in your Social Security retirement benefits, you're gonna get that Part A. It comes with it. There's nothing, we've tried before to get rid of it, and it just is part of it. If you're still covered under your employer group health plan and you like contributing to your health savings account, the IRS will no longer allow you to do that. You can still spend any money that's in there, but you cannot personally contribute, or your employer cannot continue to contribute. So for folks who love sucking money away in that HSA, and it's wonderful. I mean, there's so many things you can use it for when you get to Medicare. You might want to consider deferring coming in. Also, because of the income-related adjustments that Frank mentioned, and I'm going to show you what the premium charts look like right now. For a lot of people, it's less expensive to stay on their employer group health plan if it's getting subsidized. I mean, I manage employer group health plans as another part of my business, and some of my employers, they pay 100% of employee only, so it's hard to beat 100%. Once you get into once you defer Medicare, if you have an HSA, these are all the things that you can use your HSA to pay for once you get into Medicare. You can use it to pay your Part B premium. You can also use it to pay your drug plan premiums. You can use it for any vision or dental expenses that you have. We don't have a lot of great vision and dental options for folks who come into Medicare. So if you don't want to get one of those plans, if you have money in your HSA, you kind of self-fund that benefit for yourself out of your HSA. You can use your HSA money for prescription copays. And then you can also use it to pay for a portion of a qualified long-term care policy premium, and then really any qualified medical expense. So if you go to irs.gov and type in their search bar, there is a publication that has a voluminous list of qualified medical expenses. Anything on that list you can use your HSA money for. So here's the Part B premium chart. As Frank said, it starts off, the lowest it can be in 2019 is $135.50. The highest it can be is $460.50. So, you know, if you and your spouse are thinking about retiring, even though you have access to, getting into Medicare, even though you're still working, but if you're in one of these higher income brackets, that would be $433.40 or one of these numbers per person. If you're both Medicare eligible and you're thinking, well, I'm just going to come on into Medicare. So for me and my clients, it's a math problem. We just do the math. Is it going to be less expensive to come off the employer plan and enroll into Medicare once we add up all your premium costs?
And that's per what? Per month?
Per month. Thank you for bringing that up. Per month. Yep, and it's based on your tax return from 2 years prior. So this year they're looking at your 2017. So when Frank said there are ways to appeal your Part B premium, that's what he means. So let's say that you are retiring this year in 2019, and they're looking at your 2017 tax return. Well, they're going to base it off that full years of earnings, but for my folks who especially retired at the beginning of this year, Medicare's looking at your 2017 return, but they're not going to have any of that earned income from 2019. So you can take this form, the life-changing event form, to the Social Security office to show them that all the earned income for an entire year, if that's subtracted from your tax return, then you should be put into a lower premium bracket. And everybody who takes the time to go down there, they're successful. I always say, please go check with your financial advisor or your CPA. Make sure that taking away that earned income is going to reduce your modified adjusted gross, because that's what they base your premium on. And for Medicare, that's your AGI plus any tax exempt interest. So if taking out that earned income the year that you're going to retire is going to reduce your modified adjusted gross, and just one rung is a big difference. And here's the other part to that. Drug plan surcharge. So this is new, relatively new in the last, about 5, 6, 7 years. If you were in one of those higher income brackets for Part B, if you want a drug plan, you also will have to pay a surcharge to Medicare every month, essentially for the privilege of having a drug plan. This is in addition to the drug plan premium that we would enroll you into. So if you're in that highest income bracket, 460 and change, you're going to pay $77.40 a month to Medicare, in addition to the drug plan premium. So you don't have to have a drug plan if you don't want to, but if you defer coming in when you are first eligible and pick it up, because you can always enroll during open enrollment, with the start date of the plan would be January the 1st, you're going to have a late enrollment penalty that follows you for the rest of your days. It's not nearly as hefty as missing your Part B sign up, but it's something that we have to consider. But for my folks who take no prescription medications, just to have a placeholder drug plan where you're paying $70.90 a month, plus the cheapest Medicare drug plan I can put somebody in 2019 is $15.50 a month. So you combine those two sums, times 12, that's a lot of money for something you don't use. So it's just, again, it's a math problem. And we just look at it, or if you decide you can't sleep at night, knowing that you don't have a drug plan, then of course we just enroll you in one. But the bottom line is you have a choice. You don't have to have the drug plan. All right, so most people, if you come into Medicare and you keep your original Medicare card, your A and your B card, you're going to go look at Medicare supplements. right now we have Medicare supplements A through N. They're fancy, they're named after letters of the alphabet. And the reason why I have F and G highlighted is because the F plan, as of now, is the Cadillac of all Medicare supplements. If you enroll into an F plan, it is going to pick up 100% of your claim after Medicare pays its portion. So essentially, if you have Medicare and an F plan supplement, your medical expenses are your premiums, because 100% of your claim will be covered. The F plan's going away at the end of this year, so anybody who's in it can be grandfathered. I have read, and so I have to believe it, but they're saying if you're Medicare eligible as of 2019, but defer coming in, you still would be able to purchase an F plan when you decide to make Medicare your primary payer, but we'll see about that. I mean, that's what I read, that's what it says. But if you're turning 65 in 2020 or beyond, the F is not an option for you. But don't despair, because the G will then be the Cadillac, and the G is a fantastic plan. The G works just like the F, but the only thing you are responsible for with a G plan is whatever Medicare sets as the Part B deductible. So remember on that original Medicare card, the 4 parts of Medicare, you have Part A and Part B. There are deductibles for the Part A and Part B. In 2019, the A deductible is $1,364. That one's significant because it resets to 0 every time you've been out of the hospital 60 consecutive days. So if you're sick enough and you time it just right, you could have 6 of those. But the F and the G is going to pick that up for you 100% of the time. You would never, ever, ever worry about what the Part A deductible is ever in your whole entire life. With the G, you're going to be responsible for the Part B deductible. This year, that is $185. So that is your whopping worst case scenario out-of-pocket expense. Outside of your premiums, you pay the first $185 in physician fees. And Medicare does have to pay some routine preventive care at 100% on their nickel. So if you're just going for your annual physical, you might not even have to pay the $185. Because some of the things you're having done, they might have to pay it on their own nickel. But $185, worst case scenario. So the way the Medicare supplements work, they're the same benefits no matter whom you purchase them through. It is exactly like shopping for an appliance. You can go looking for your Samsung TV, but you might get it cheaper at Target than you would at Best Buy. Same thing with these Medicare supplements. They're all the same benefits. The government standardized these plans to protect you. But every single carrier charges you something differently. So that's what I think my job is. As a consultant, I'm not a broker. Why wouldn't I put you in the plan that gives me the highest commission? And Blue Cross Blue Shield of Tennessee, for most of us, we've been covered under Blue Cross our entire lives. They have some of the highest Medicare supplemental premiums. They pay big commissions to their agents, that's why. But this is what the Medicare supplemental world looks like. Now I'm going to talk about Medicare Advantage real quick. So with Medicare Advantage, I told you it's a completely different delivery mechanism of your Medicare benefits. And what Medicare Advantage does, it pretty much takes Part A and Part B, a Medicare supplement, a Medicare drug plan, and rolls it into one product. So instead of having to have 3 separate policies, you can combine it into a Medicare Advantage plan. They do not work at all like original Medicare, your supplement, and a standalone drug plan. Why? Because they're copay plans. There is a copay for absolutely every single thing you do, and every carrier, they have their own copay chart. And these plans, Medicare Advantage plans, also have maximum out-of-pocket. So most of it's in this room, if you have an employer plan, or even if you just have an individual plan, we have deductibles and we have an out-of-pocket maximum. If your copays all add up to your maximum out-of-pocket in a calendar year, then your Medicare Advantage plan has to pay the rest of your claims for that year that are in-network and cover benefits at 100% on their nickel. So typically with Medicare Advantage plans, there's 3 different options to choose from. I'm going to use Blue Cross Blue Shield as an example. In our area, they have the Garnet, the Ruby, and the Diamond. So the Garnet plan is what I call the zero buy-up plan. There is no additional monthly premium outside of your Part B. Remember the Part B chart? So let's just say you were at the 135.50 level. You could get the Blue Advantage Garnet plan for $135.50 a month. That's it. If all your copays in a calendar year added up to $6,700, because that's the max out of pocket, they have to pay the rest of your in-network benefits that year at 100%. Medicare Advantage has some built-in, they have a little bit more deeper, broader routine preventive benefits. So a lot of these plans have a little bit of built-in vision and dental. Some of them also have some hearing aid benefits. You have to use their providers. And for hearing aids, because if anybody has hearing aids in this room, they're very expensive. You have to use the brand that they have a contract with. And then typically they'll give you like up to $750 for the purchase of that hearing aid. But that's still more than original Medicare. Original Medicare will let you go to the doctor and be diagnosed that you need hearing aids. They're not going to help you pay for those. This chart right here kind of outlines a few of the basic differences between traditional Medicare and Medicare Advantage. So with traditional Medicare, because you can have up to 3 separate premiums, you could have higher premiums than a Medicare Advantage plan. The reason I say could is back to my example of Blue Cross's Medicare Advantage plan. The Garnet is the one with no additional monthly premium. Ruby this year is somewhere around $80 a month, and the Diamond plan is $214 a month. Really what you're paying with that premium is to get your out-of-pocket reduced from that $6,700 down to something lower, but you gotta do the math. You gotta multiply $214 times 12, and that's about what they're taking off your maximum out of pocket. So it's not really as wonderful. And if you are going to be willing to spend $214 a month, because that's more expensive than any Medicare supplement I could put you in at 65. I'm going to talk you into Medicare, original Medicare with the Medicare supplement, because you just get so much bang for your buck. So what is that bang for your buck? With traditional Medicare and a standalone supplement, all of Medicare is your network. Any medical provider anywhere in the U.S. territory is in your network. With Medicare Advantage, you have to stay in your plan's network, just like your employer plan or an individual plan. And why is that significant? Because let's say you got diagnosed with something and you wanted to go to MD Anderson, the major cancer hospital in the U.S. You can't get there on an in-network benefit with a Medicare Advantage plan from Tennessee, because we don't have that hospital in our own backyard. Medicare Advantage plans want to keep you in your own backyard, so to speak, for your care. So there are some Medicare Advantage plans that have in and out of network benefits, but it is almost impossible to get out of network physicians to see you. I've tried to help clients, I've talked to the billing people, we have in and out of network benefits. I'm happy to send you the summary, and they're like, we don't participate with that plan, we're just not going to see them. And an example of that is 4 years ago, Blue Cross Blue Shield and Vanderbilt parted ways. They decided at the 11th hour they didn't need each other anymore. So anybody who was in a Blue Cross Blue Shield Medicare Advantage plan who saw Vanderbilt physicians, they had to either get a new physician or they had to switch plans. Because what Medicare Advantage plan sales people will not ever tell you, but I'm telling you this, and this is important to remember. When you enroll into Medicare during your applicable enrollment period, and if you want to go get a Medicare supplement, no one can ask you any medical underwriting questions. You come in, you could have 10 major diagnoses. Doesn't matter, they can't ask you anything. If you wait past the first 6 months that you are effective with your Part B to sign up for a Medicare supplement, they can start asking you medical underwriting questions. So what typically happens with my folks in Medicare Advantage, like, I can save money. I'm going to get that Blue Advantage Garnet plan. I don't have to pay anything more than my Part B premium. Then let's say 8-10 years down the road, they want to start seeing people in other cities and other states. They're sick, they've got to get to somebody. you can't pass medical underwriting to leave your Medicare Advantage plan, you can always grab your Medicare's original Medicare card. That's always available to you, but there's nothing available to you to shore up what Medicare doesn't pay, and it can get frightfully expensive. So that's the takeaway. None of us have a crystal ball. If you sign up for Medicare Advantage and you want to leave down the road, you're going to have to pass medical underwriting to be able to get into a Medicare supplement. So people say, well, then what's the advantage? Well, the advantage is you've got more routine preventive care if you want it. You would pay less per month, possibly, if you choose the zero buy-up plan. But you've just got to be comfortable with that decision because you might be in a Medicare Advantage plan for the rest of your life. And I'm going to spend 2 seconds on the Medicare drug plan. I haven't found a new cartoon that I like any better, but I can explain the meaning of life, but I cannot explain Medicare drug coverage. Medicare drug plans are not like anything you've ever seen. It doesn't mimic anything. We have 4 different coverage phases at the moment in a Medicare drug plan, and we have 29 different plans to choose from in our area. If you want to pick a Medicare Advantage plan, we have 23 of those that come with a drug plan attached. If you don't want the drug plan, remember, because you'd have to pay so much for that, and you'd rather not, because you take inexpensive medications, we have 3 choices for Medicare Advantage plans that don't come with a drug plan. And people will say, what's the best plan for me? And that's like, it's based on your personal prescription list. With 29 different plans to choose from, it's like a Rubik's Cube. We just got to look for who's going to give you your medications for the least amount of money out of your pocket. And you can always change your drug plan from one year to another. That's during open enrollment. Open enrollment is just about to start, October 15th through December 7th, every calendar year. So people that have Medicare as their primary payer, that's when you start making changes, if you want to. You don't have to, but that's the only time, unless you move out of your coverage area or you move into a nursing home. Okay, these are the coverage phases for a Medicare drug plan through the end of this year. We have a deductible, we have an initial coverage phase, we have the coverage gap or the donut hole. Has anyone ever been in the donut hole or had family or friends? Or catastrophic coverage. Good news is the donut hole goes away at the end of this year. So we're not going to have to worry about that one anymore. It's a whole year early. We're supposed to leave at the end of 2020. The highest a drug plan deductible can be, Medicare sets these limits every year. It's the highest can be is $415. Not every drug plan has a deductible, but if they do, they can't go past $415. People will say, well, wait a minute, does that mean I have to pay $415 out of my pocket before my drug plan starts working for me? No. Your purchases are applied to your deductible. That's the way that works. You and your plan in 2019 stay in the initial coverage phase, which is typically where you get your best copays unless you get to catastrophic. You're in the initial coverage phase until you and your plan together have paid $3,820 towards the purchase of your medicine. So I'm going to give an example. If your medicine retails for $50 and your copay's $10 and your plan's going to pick up the additional $40, then it's the $50 that has to go to the Walgreens when you pick it up. It's that $50 that marches towards the $3,820. So if you get to that magic number in 2019, that's when you go into the coverage gap. And in the coverage gap, you have to pay more depending on the plan you have. Some plans help in the gap, some plans don't. But you typically have to pay a little bit more for your medications, especially if you're taking brand name drugs. So my folks who have to take a brand name drug, not everything has a generic equivalent, and not everybody responds well to the generic equivalent. Pay a lot more. It's not a good thing. Which is why I say Medicare drug plans are nothing like what you've experienced on an employer plan or an individual plan, because it can get very expensive. Case in point, if you hit catastrophic coverage, which in 2019 means that you've personally paid $5,100 out of your own pocket towards the purchase price of your medicine. So if you go beyond $3,820, then between $3,820 and this magic $5,100, they're only looking at what you personally contributed between your deductible period, the amount that you paid in initial coverage, that those two sums are added together, but then you've got to pay the difference up to $5,100. But at the end of the day, if you get into catastrophic coverage in 2019, you've paid $5,100 out of your own pocket towards the purchase price of your medications. When that happens, you're just paying 5% of the retail of your drug, which is low, but good grief, you've already paid $5,100 out of your own pocket. So that's why it's really important to make sure that you're in the right Medicare drug plan. And so what I tell my clients is, if you don't want to look at it every year, we don't have to look at it every other year. But for 90% of the folks out there, there will be a less expensive plan for you, at least every 2 years. I mean, I have some folks who I transition into Medicare, and I don't hear from them for 8 years. I'm like, oh my gosh, my medications are costing me a fortune. And I'll pull their file and I'll be like, wow, I haven't seen you in 8 years. Are you still in that same plan? Yes. Well, a lot of times, the drug plans can, every year during open enrollment, they can take medicines off their formulary, they can increase their premiums, they can require step therapy or other restrictions on their plans. So that's why it's important to look at it. Everybody who's in a drug plan, you get your new book for the coming year. It comes in the mail right about now. And you want to make sure all your medicines are covered and that they're pretty much covered at the same level, because if they're not, if they've increased significantly, or if they've increased their premium significantly, or even their deductible, more than likely is a better plan out there for you. So it's just a really good idea to look at all that. So what do you do now? If you are about to turn 65 and you're thinking, yes, I want to come into Medicare, or if you're not on an employer or a union plan and actively working, or the dependent of someone, you have to come in around your 65th birthday. So you would want to work within your applicable enrollment period to enroll into Medicare. If you're already enrolled, open enrollment starts 15th of next month. That's when you get to start looking at things, if you want to make changes. And if the same plan works for you, then you don't have to do a thing. It just rolls right over. You don't have to tell your Medicare supplemental or your Medicare Advantage plan or your drug plan that you want to stay in it. They just assume no correspondence from you means that you want to be there. And so where can you get help? Like I said, I get on Medicare.gov multiple times every day. It is a wealth of information. That is the 800 number to Medicare, kind of like Social Security, like Frank said. Sometimes you get people who really know what they're talking about, and sometimes you don't. This is my contact information, and then I put the Tennessee SHIP in there. Every state has a SHIP office, the State Health Insurance Program Office, and these folks can do Medicare consulting. They can just tell you about it. They can't advise you on what to do or what options are out there or what carriers might be the best for you. They're not going to tell you which Medicare drug plan is best for you, but they can advise you on all of it. So I give the SHIP number in there. And it's run by volunteers, so again, you might get someone who's seasoned and has worked there a long time and they're fantastic, or you may get somebody who's brand new and they don't really know what they're talking about. So that is Medicare 101 in a nutshell. Do y'all have any questions? Yes.
What about, reading medicine? I actually, my doctor tell me that the Medicare physicals are lesser than what you were used to getting before.
That's true. So in the first 12 months that you have your Medicare Part B, they call it the Welcome to Medicare Physical. And I've transitioned in a handful of doctors, and the majority that I hear from, they don't like that Welcome to Medicare Physical. If you are squeaky clean, there's not one diagnosis they can put on your annual physical, then chances are you're going to be paying a significant amount of money for that annual physical. It used to be that Medicare didn't have any routine preventive care they covered. But now they have to have a few things that they do cover. But yes, you can find yourself paying for your annual physical, which is something that you've never had to do before. So yes, that is true.
You pay that out of your own pocket.
If you have some diagnoses, so let's just say, lots of people are taking a statin drug for cholesterol, or you may have a blood pressure medication, then that's always gonna be on your claim as well. So if they can tie back some of those other tests to those diagnoses, then more of your claim gets covered, or maybe all of it gets covered. But Medicare doesn't have to pay all their routine preventive care items every single year, which is also very frustrating. Case in point, the they call it the cardiovascular disease screening test, which is your lipid profile. So when they're looking at your cholesterol level, if you're squeaky clean and you go to your physician every year for your annual physical and they're always doing your lipid profile, Medicare pays for that once every 5 years. They'll pay all day long for you to be in the hospital with a heart attack or a stroke if they're not going to pay for that test. The good news is Medicare has deeply discounted labs, so that test, the most I've ever seen, it was cost about $40, but it's counterintuitive, but so much of health insurance is counterintuitive.
So you have to educate yourself really, because like I said, I just haven't known my doctor really well, and he told me that, because otherwise I would have never known that there was a difference between my routine, my preventive
Right.
physical today, it was 10 years ago.
Exactly. Yeah, so thank you for raising that question, so everybody's aware of that. Yes?
There again, I know you don't have a crystal ball, but with your experience, do you feel like once part of the Plan F goes away, do you think the premiums for that will
Oh, absolutely.
skyrocket for the ones that are on Plan F?
Yes,
Okay.
so
So do you
we,
think it would be wise to move to Plan G,
If-
or can we, if we stayed on Plan F, 3 years down the road, could you move to Plan G, or you got to do it this year?
well, tell me who your carrier is. There's one carrier that doesn't make you pass any medical underwriting questions to move from the F to any other one. So who is
Blue
your,
Cross Blue Shield, Tennessee.
you need to move. So, because you're gonna have to pass medical underwriting, and like we just said, you don't have a crystal ball, so 3 years from now, if God forbid you had something that precluded you from being able to pass the medical underwriting, you're stuck in the F. So I would just go ahead and switch to the G, especially because in a full calendar year, the difference in premiums between the F and the G, even subtracting out that Part B deductible, you still saved money. So I have folks who are like, oh my gosh, I'm losing my Part F. I'm like, G is fantastic. $185, that's your worst case scenario number. My worst case scenario number is $13,500. So 185 is good.
So is G like F as far as, I need no referrals to
Correct.
see another doctor or anything?
Oh, right, no, with Medicare supplements, there's no referrals necessary, none, and it's transferable. So let's just say you decided to move to Florida, everything goes with you to Florida. You don't have to get a new Medicare supplemental. You have to purchase your Medicare supplement in the state where you're living when you turn 65, but if you move, it doesn't matter, it gets to go with you. Medicare Advantage, you gotta get a new plan if you move. Which isn't the end of the world, but it's another step you gotta take care of. Yes?
How do you operate on someone's behalf? I'm sorry. So like say like a parent or a grandparent or even just a client where they're not able to sign up or, handle their own affairs as far as insurance. Is it just, does Medicare make it specifically difficult, or is it just a POA?
What do you mean to enroll? To
Enroll.
actually enroll? Well,
Enroll
if you
in-
enroll at 65, it's super simple because it's online. I mean, like Frank said, now you have to create your My Social Security account. As of October of 2018, if you're coming into the Medicare universe and we're going through the online portal, which is the easiest way to do it at 65, then you just create the My Social Security account, and that's how we go to enroll you into your benefits. And they wouldn't know if you were helping someone or not. I mean, there is a little button you click, I'm applying for myself or helping, have someone helping me. And you're like, yes. But if you have to go down there, you are going to have that POA, and you have to show that relationship. Is there another question? Yes.
Portability, I mean, in terms of travel, obviously Advantage plans are based on locale. Are any of the Advantage plans better or worse, or kind of neutral about what happens when it happens out of state or even out of country?
So, even with Medicare, there's no out-of-the-country benefit. Depending on what Medicare supplement you choose, they could have built-in travel benefits outside the US. It's up to $50,000 in your lifetime after a $250 deductible. But some Medicare Advantage plans, I noticed in the last couple of years, they have kind of a travel reimbursement program. It just depends. What I like to tell my clients is to look at something called MedJet Assist. It's just medjetassist.com. It's a medical jet that will fly wherever you are as long as you're 150 miles from home. And then they'll bring you back to the hospital of your choice. I've had several clients that had to use MedJet, and they gave them rave reviews, and they have to wait till you're stable, but they'll bring you back. But as far as having robust travel insurance, that has to be purchased outside of your health insurance. If you want actual health insurance, it's going to work for you. But outside the U.S., it's just so much less expensive than it is here. So, $50,000 goes a long, long way. And I've had several people say they got sick when they were in Canada or Great Britain, and they didn't pay a thing. I mean, they'll tell you on the website, if you go and look at it, if you're a traveler in our country, don't expect us to pay for your health care on our nickel. But the majority of the people that I've heard from, they paid nothing. So. But MedJet Assist, it's worth taking a look at it. I've purchased it when I've gone out of the country. I haven't had to use it, but it's peace of mind.
Yeah, you may not, can't promote one over the other, but do you have a preference, like Cigna, Aetna, Blue Cross Blue Shield, United Healthcare?
So when folks come in at 65, nobody undersells the Tennessee Farm Bureau for their Medicare supplements. They have the best prices. Spouses who come in later together, or not even together, doesn't even matter, but spouses, if you have a spouse, Mutual of Omaha gives a 12% spousal discount. And they also rate men and women separately. So women always have lower premiums than men. And then, so combined with the 12% discount, a lot of times Mutual of Omaha can beat the Farm Bureau. But if you're just an individual, or my folks who are like, I want to enroll in an F plan, I just want that F, then I'm taking them to the Farm Bureau this year, because Farm Bureau will not make you pass medical underwriting to move from an F to a G, ever. So I'm like, all right, then let's go there, because Mutual of Omaha would, Blue Cross Blue Shield would, AARP would, everybody else is going to make you pass medical underwriting to move from the F to the G.
But if I do it this year, I don't have to.
Correct. Well, no, if you move, how long have you been on your Medicare supplement? Have you had it longer than 6 months?
Yeah.
Then you're going to have to pass medical underwriting to move, unless they've got some special going on for everybody at the end of this year, which they might. I would call them and find out. I just haven't put anybody in a Blue Cross Blue Shield Medicare supplement because they're just much more expensive.
I'm through a group with AT&T.
Oh,
So it's a little different also.
okay. Well, that's a horse of a different color. Do you get subsidized from AT&T to help pay for that, like a part of a retirement benefit? Yeah, you may want to stay. That's one of those things where if you have access to Medicare supplements through a retiree plan, typically what you are paying is going to be less than what everybody else has to pay. So for that reason, it may be okay, but you'd probably save even more money if you could move from the F to the G. I would just ask. Yeah, but I'm glad you brought that up, yes.
Isn't there like a rating out there on the different Advantage plans?
Oh, Medicare.gov.
Yes, like on Aetna versus say.
Honestly, I'll tell you all this. I mean, they're all the same plans. The benefits are the exact same. And really, Medicare is the driver of the vote. So if your claim's gonna get messed up, typically it's at Medicare or it's with your provider. Like they are not keeping up with doing the adjustments or what have you. But I don't even know the last time I had to call somebody's supplemental carrier, because they just kind of can shut their eyes. They just pick up the 20% after Medicare paid its portion, or they pick up the deductible that Medicare doesn't cover. I mean, it's very hand in glove. So you just don't have problems with the supplemental carriers. It's very unusual. And the government has also safeguarded Medicare beneficiaries. If your Medicare supplemental company were to go out of business, then that puts you in a guaranteed issue posture to go get another plan without ever having to answer any medical underwriting questions. But yes, they are rated. I just don't know what those ratings necessarily mean. Like, what kind of questions are they asking? How big is the population of people they're asking? You know, is it all an opt-in online situation just from disgruntled people where all the happy people never bother to do the survey? It's just unclear as to what exactly those stars, what they're based on. But yes, you can go to Medicare.gov and you can get it.
But then you still got, but what do you turn? You just got to call your physician, see who, on the Advantage plan, see which one takes which.
Yes, on the Advantage plan, you want to make sure that all the physicians you want access to and the hospitals you want to get to are in that network. So it's very important. I would always call the physician's office and hear it from them personally. You know, Dr. Jones participates with, the main two that they participate with in our area is Cigna Health Spring and Blue Advantage. And then a lot of the third is Humana. But there's not always, Vanderbilt participates with a lot of them because they have to, because they're a big hospital. But the rest of them not so much.
What about Aetna?
I haven't put anyone in a Medicare Advantage plan in, I don't know when. But if it works for you and all your physicians are in it, that's great. It would be fine. All right, Carrie, let me
Yeah.
stop.
Does anyone else have any other questions? Because I just want to make sure we get out on time. I know some people have already had to leave. But we will, Margaret and Frank usually give their presentations, so I have them and give me permission to send them to you, so I can have those available to you as well. It will have their information in there, and so I just hope you guys enjoyed it
Thank you
today.
all.